Hey everyone, Doc Anderson here. Thanks for tuning in. Hey, I just want to make a video real quick and discuss a little bit about dental insurance. So if you're in the market thinking about buying dental insurance, you're not getting it through your employer, and so I'm going to help you crunch the numbers and help you determine whether or not it is a good financial decision for your dental care. All right. So I made this chart here, and I have a blue side and a green side. The blue side is the numbers related to someone who is seeing their dentist and paying their fees out of pocket. And the green side is for someone who has dental insurance, okay? So let's look at monthly premium. Well, if you don't have dental insurance, well, you don't have a monthly premium. So that's going to be zero. If you do have insurance, your premium is going to probably average around $46 per month, okay? Now, one thing to consider about this number is that this number is taking into account someone who is not getting insurance through their employer. If you get dental insurance through your employer, it's going to be much cheaper than this, okay? This is the average cost of someone who's actually buying directly through the dental insurance company. I actually got these numbers from a dental insurance company straight off their website, and they have policies ranging from $33 per month upwards of $71 per month, okay? But average is around $46. So per year, you're going to pay around $552 per year for your premium for insurance, and over 10 years, you're going to pay around $5,520 over 10 years, okay? So I went ahead and put 10 years in here because sometimes it's good to look at those costs over an extended period of time because that can also help you make a better decision, okay? Now let's look at some of these services. So for basic services for preventative care, cleanings, exams, and x-rays, you're going to pay $100 per cleaning. Most people get 2 cleanings per year, so you're looking at $200 per year or $2,000 over a 10-year time frame. For exams, typically someone gets an exam with every cleaning, so you're looking at 2 exams per year or $120 per year or $1,200 over 10 years. X-rays. Average person gets x-rays about once per year. Now, depending on if you're someone who gets lots of decay, your dentist may say we should probably take x-rays every 6 months. But if you're someone who never gets cavities or gets dental treatment, your dentist may say, well, let's just take x-rays once every 2 years, okay? But average is one time a year, so $80 average. So you're looking at $80 per year or $800 over 10 years. So the average cost of an individual paying out of pocket without insurance is going to be around $400, okay? And this is just preventative care, all right? Cleanings, exams, x-rays. This doesn't include fillings, crowns, root canals, stuff like that. For the insurance patient, they're going to still pay, even though all these services here are included, they're still going to pay $552 per year. So they're still paying more than the cash paying patients, all right? So keep that in mind. The insurance patient is also paying almost $5,520 over 10 years. The cash patient is paying $4,000 over 10 years, okay? So let's say you're someone who needs a little bit of work. I'll take myself for example. I've had 1 crown in 10 years, so I'm going to use that in this scenario here, okay? So for someone who's paying cash, they're looking at probably around $1,200 a crown. Again, this varies by location and dental office. And then typically when someone gets a crown, they'll need a core buildup. So a cash paying patient will, $312 for a core buildup. So a core buildup is basically if you need a crown, you're missing some tooth structure, so you have to build that back up so there's something for that crown to grab onto, and that's why you need a core buildup. You don't always need it, but more times than not, you're going to need a core buildup. So the cash paying patient is going to pay around $1,500 out of pocket compared to the insurance patient who has an extreme discount compared to the cash paying patient. They're going to pay around $400 to $500 out of pocket for their crown, okay? So they get 2 benefits. They get, the first benefit is they only have to pay for 50% of that crown, typically. And the dentist has signed a contract with the insurance company saying he can only charge a certain amount or a certain fee. So the patient gets that benefit as well. So they only have to pay 50% of that fee. So that's why they pay such a small amount compared to the cash paying patient. So this patient paid $405 for the crown. and $24 for the buildup compared to, you can see, huge savings now. All right. But if you do look at these numbers over time, over a 10-year time frame, the insurance patient still paid more over 10 years, okay? So the insurance patient paid almost $6,000 over 10 years compared to the cash paying patient who just paid $5,500 over 10 years, okay? Now let's look at one more scenario. Let's say these individuals needed 2 crowns, okay? Now, once you get into this territory, now insurance is starting to save you money, okay? So the cash paying patient over 10 years is going to pay $7,000, and the insurance patient is going to pay $6,353 over a 10-year time frame. So if you're someone who needs more work, is, let's say, getting a crown every year and getting fillings, then it makes sense to get insurance. You're going to save more money, okay? But if you're someone who has only had 1 crown in 10 years and doesn't get very many fillings, gets them occasionally, but really just needs something for routine maintenance and care, then insurance doesn't make any sense and you're not going to save money. You'll save more money actually paying out of pocket. One other caveat with insurance is that if you're someone who needs an excessive amount of dental work, insurance puts a cap on how much they'll pay per year. So your insurance may only pay $1,000 or $1,500. So if you need work in excess of those amounts, you're going to have to pay 100% out of pocket for any additional care. Okay. Also, dental insurance doesn't pay for cosmetic. So if you want veneers or if you want teeth whitening, even though you're paying an insurance premium, that's still not going to be covered by insurance, and you're going to have to pay those services 100% out of pocket. So all things to consider. Hopefully you found this video beneficial and it helps you make a decision on whether or not you're going to purchase dental insurance for yourself. If you like the video, please like the video. Also like my Facebook page. And hey, thanks for watching. My name's Dr. Anderson. My office is called The Dental Boutique. I'm in Scottsdale, Arizona. And hey, have a great day. Bye.